So we are talking about the shoulder joint. Shoulder joint, we start with the type of joint. It is a multi-axial ball and socket type of a joint of synovial variety. Articulating surface, we want to always write medially glenoid, laterally head of the humerus. In the articulating surface, medially there is an additional secondary socket made by coracoacromial arch. Ligaments, how do we remember? 1 plus 2 plus 2, one capsule, which is there attached to the glenoidal labrum medially and to the anatomical neck laterally. Inferiorly goes up to the surgical neck. There are two openings, one for the biceps brachii long head tendon and bursa dictu subscapularis. Two ligaments. How do you remember the remaining four ligaments? Two glenoidal labrum made up of fibrocartilage to deepen the glenoidal cavity, and three glenohumeral bands which run anteriorly, upper, middle, lower, superior, middle and inferior. Two humeral ligaments, coracohumeral ligament running from the base of the coracoid process to the neck of the humerus, and transverse humeral ligament which runs from greater to lesser tubercle, plastering the long head of the biceps brachii. So superior stability happens because of that. This is the musculotendinous cuff made up of subscapulary, supraspinatus, infraspinatus and teres minor. Stabilizes the shoulder joint anteriorly, superiorly and posteriorly. The nerve supply, main nerve supply is axillary nerve. Okay, main nerve supply of this is axillary nerve. There are other nerves also supplying it. The blood supply, main anterior circumflex humeral and posterior circumflex humeral artery and other branches of brachia. In the actions taking place at the joint, three actions: extension, adduction and miliary rotation. All of them are caused by pectoralis major, latissimus dorsi and teres major. Flexion has to be done like this, not like this. Okay. Extension has to be done like this, behind, extension. Abduction has to be done like this, not like this. Abduction and adduction. Okay. Flexion is brought about by pectoralis major, the clavicular fibers, biceps brachii, short head, deltoid anterior fibers and coracobrachialis. Lateral rotation is brought about by infraspinatus and teres minor. Medial rotation I have already shown. Abduction, I am going to make a separate video for that. And abduction is brought about by supraspinatus, deltoid, upper and lower fibers of trapezius and serratus anterior. In applied anatomy, you have to write about shoulder dislocation. Okay, and you have to write about shoulder tip pain, because shoulder is also supplied by the phrenic nerve, not the phrenic nerve, the root